Welcome to VetMed TV. Today we're going to be talking about preventing diseases, or preventive care. As you can see, we're at the park. We've got lots of dogs running around us. But how do we know if they're really healthy? That's what we're going to talk about today. Two parts of checking up and preventing disease. One is a good physical exam, and the other is working out what's happening on the inside, the internal health check. Firstly, what we do, let's have a look at puppy's teeth. We can see that there's a little bit of brown tartar forming on the teeth, but also there's a little red line forming along the gum line between the teeth and the gum. That tells us gingivitis, and that's a little bit painful. What we're going to do with puppy is get her in for a teeth clean and start her on some food that's going to help reduce tartar and gingivitis. Puppy's eyes are a little bit red. You can see her blood vessels. I'll show you this one as well. That's a sign. Essentially, in dogs, the most common cause of conjunctivitis is allergies. And speaking to puppy's owner, puppy also licks her feet as well, so it's a sign that she's got a little bit of conjunctivitis. Right? So we can get some drops to help prevent that. Let's check puppy's ears. Just got a little dot down there, just a very little one. Just again, showing us that she's got little signs of allergies. This ear is beautiful. That's a nice clean ear. That's really, really important. Then we have a good feel of puppy's lymph nodes, because that shows us if she's got any signs of infection, or in older dogs, sometimes we see cancer of the lymph nodes. So under her chin, in here, and we run our hands down all over puppy. If you have a look at puppy's leg here, she's got a little bit of a brown stain on her leg. Again, that just tells us puppy's been licking her leg. Two causes of that. One is she's itchy, and the other possible cause is she may be a little bit bored when she's left at home. She gets a little bit nervous, so they lick the one spot. So we'll talk to her owner about that later on. Can we feel puppy's ribs, and can we feel puppy's backbone? So if we can't feel them, puppy is a little bit overweight. If puppy was wet and we could see the backbone or the ribs, that means puppy's too skinny. The good news is to say, I can feel puppy's ribs really well, and I can feel her backbone, which means she's an ideal weight. Fleas love to live up in the back here. So if you part the hair over the tail, you'll sometimes see fleas or flea dirt. Puppy's owner looks after her very well, so there's no flea dirt or fleas on her at all. The other good place to have a little look for fleas is they love to run around on where there's not much hair on their belly, so that's another good place to have a look if you've got any fleas. When we're going through it, this is part of what we train for as vet school is we have a feeling, can we feel her liver, is it bigger or not? Can we feel her kidneys, are they abnormal? The spleen, the intestinal tract, is there any lumps or bumps in there? Back to the bladder. If it's a male dog, can you feel the prostate? They're things that we're having a good feel for on our fingertips. And after you've obviously done lots of palpation like you do with your vet, you get to feel lots of different things that are normal and abnormal. Good news, puppy is all normal. Great, good deal. Alrighty, as we can see there, puppy's temperature is 38.9, which is normal. The normal sound for a heart is a lub-dub, lub-dub, lub-dub. Common sounds that are abnormal are whoosh sounds, a whoosh, 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 which tells us we've got turbulent blood flow through the heart, or a valve that's leaking. And the other thing we listen for is the rhythm. So is it regular, boom, 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 or is it blop, blop, boom, 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 boom? So they're things that we're listening for to make sure that puppy's heart's working really well. I'm just going to have a listen to her heart now. Great news, puppy's heart sounds great and the rhythm's really normal. Good girl, gorgeous as you are. So I'm feeling for any crackling, crunching, that the legs are working well, the kneecaps in place, hips feel comfortable. Good girl. What we'll do is just gently have a look at underneath puppy. So we're looking for, is there any skin disease? Have we got any lumps there? Good girl. That's great. Underneath puppy looks really good too. Great thing is we've found a couple of things that we can help puppy's owner prevent, like her teeth, her eyes, and a little bit on her skin. But what we don't know is what's happening on the inside of puppy. And that's really important. What's her liver function like? What's her kidney function like? How's her pancreas working? Has she got any signs of infection that we can't pick up on physical exam? So what we're going to do is take Puppy just out the back, take a little bit of blood, and then we can reveal what's going on the inside. Here we are, we're in the second part of our preventative care, which is taking blood for our internal health check. So we've had a good look at Puppy on the outside. Let's find out what's going on inside of Puppy. To do that, we just need to take a little bit of blood, okay? So Puppy's got beautiful hair, so we're gonna have to take a little bit of her hair off. Dogs that don't have, or cats that don't have a lot of hair, we can usually wet it down and it's not too bad. She's a very good girl. You're a very good girl, Pup. You are a very, very good girl, beautiful girl. What a good girl. So this little purple top tube is for doing the red blood cell count and the white blood cell count. Just mix that. The red top tube is for doing the biochemistry, like the liver enzymes, the kidney toxins, the calcium, those sort of things. So as you can see, simple little procedure, taking a little bit of blood. Pups was fine. Blood's going to tell us a lot more information about what's going on inside Puppy. We're looking for diseases that are not obvious or subclinical diseases. So our physical exam is really important because as a vet, we train for 5 years. We can pick up things that you might not see. We can feel things in the tummy. We can pick up lumps. We can look at things that are going to help stopping your dog or cat getting sick. So the internal health check looks at up to 42 different parameters, which is going to really give us a very good idea what's going on inside Puppy's body. If we get some abnormalities, we can firstly check them, make sure that they're not getting worse, but it's also going to help us take the next step to work out what is going on before they get sick. No, she loves it. She loves it. What's that?